Hello everyone, my name is Kerry Arabena and I'm a very proud descendant of the Meriam people from the Torres Strait. I have worked in sexual and reproductive health for over 20 years and am so pleased to be part of the promotion team who are looking at this important resource, just as I am very proud of you for reaching out to do the very best that you can do for our young people in your care. I can appreciate how daunting conversations and strategies about sexual and reproductive health can be to have with young people, particularly if you feel like you don't have the correct information. Perhaps you feel like you're not the right person to be having these conversations, or maybe it is difficult to find the right time. Whilst we feel uncomfortable to have these talks, we should also feel concerned that young people are not accessing information to enhance their own health and well-being, and their experiences of empowerment are paramount in sexual and reproductive health issues. And this is key. We have thought about how to support you provide young men and young women information that can support them make healthy choices. This resource will support you engage with different conversations on the multitude of topics related to sexual and reproductive health, and support you help our young people access services they need when those healthy choices are impossible to make. Understanding how culture, traditions, customs, and history influence health is integral to providing effective and culturally competent health care for young Aboriginal and Torres Strait Islander people. Also, understanding that our sexual and reproductive health concerns are much broader than those discussions that we normally have about STIs and contraception. Therefore, the provision of sexual and reproductive health information is greatly enhanced when we carefully consider the physical, spiritual, emotional, and social well-being of young people in your care. It must be acknowledged that individual adolescents will have a significant difference in the way that they use cultural practices, beliefs, perspectives, and behaviours. This resource is therefore not intended to be prescriptive, but to provide general guidance for those providing care to Aboriginal and Torres Strait Islander adolescents, particularly those who may be experiencing vulnerability and may not know who to turn to. We all know that in seeking sexual and reproductive health care, young people need to feel protected, empowered, and culturally safe. How you interact with young people will have a significant impact on how they respond to you, their health outcomes, and how they seek health care into the future. The benefits of accessing culturally safe and respectful information is clear. Young people who have the capacity to appreciate their own sexuality and who have pride in their bodies are better equipped to pursue all things related to prevention, diagnosis, treatment, and management of their own sexual and reproductive health, and ultimately their own well-being. This resource is absolutely about empowering people through information about healthy relationships, being same-sex attracted, how to approach uninformed family members and friends about the choices that they make, and how to be in control of their own sexual health. This resource will support you understand and address reasons why adolescents may delay seeking sexual and reproductive health care, including that they may be in power imbalanced relationships, they may have experienced sexual assault, and they may have shame of discussing their problems with healthcare workers or of having an examination. There could also be a deep fear that others will be aware of their problems and people in the community will talk about them, or that their confidentiality will be breached. And it is for these reasons that we need to explore more than the dangers of sexual activity, such as contracting STIs, HIV/AIDS, unintended pregnancies, sexual coercion, and sadly sexual violence. And over the last 20 years, and particularly the last decade, we've sought to address the issues of positive aspects of sexuality. There is a burgeoning field of evidence to indicate that sexual health, physical health, mental health, and overall well-being are positively associated with sexual satisfaction, sexual self-esteem, and sexual pleasure. The beneficial effects of sexual satisfaction should be integrated into programs that seek to improve health outcomes for our young people in your care, and you have vital roles in ensuring that they have access to effective services, prevention, and sexuality education. Beyond these key subjects, though, mostly you'll be empowering young people to explore how to love themselves, their bodies, their sexuality, and their partners. We have young people in care who've been deprived of these experiences and who may not have had access to role models to teach them about how to express their feelings in powerful and tender ways. These young peoples are future elders and ancestors for generations to come. How we engage with them during this period of time can only enhance who they are and how we can all be together. We hope that you enjoy the experience and the resource, and remember, practice makes perfect. Thank you for watching this video, and we wish you all the very best both now and into the future. Take care, have fun in the discussions. Goodbye for now.